welcome back. In today's video, we will be talking about PAD. So what is PAD? PAD is a disease which includes both arteries and veins. It is called the peripheral artery disease, which refers to disorders of the blood arteries outside the heart and brain. They are commonly caused by the buildup of fatty layers in the arteries. Atherosclerosis is a condition in which plaque consisting of fat, calcium, fibrous tissue, cholesterol, as well as other substances is produced in the arteries. This plaque is applied to arterial walls and it hardens over time, restricting the path to blood flow. This obstruction restricts healthy oxygenated blood to the organs, muscles, and other areas of the blood. Over time, reduced oxygen levels induce other signs that can cause other serious issues. Though PAD mainly affects the arteries in the lower extremities, there have been cases when it has also impacted other areas of the body. And since peripheral arteries operate for all arteries that bring oxygenated blood from the heart to the limbs, liver, brain, and kidneys, they can also be affected. PAD is a narrowing of the peripheral arteries that include the legs, chest, arms, and head. After all this talking, I would love to include some quick info about PAD. The most frequent signs of PAD affecting the lower extremities include cramping, discomfort or tiredness of the leg or hip muscle when walking or climbing the stairs. And usually, this pain goes down with the relaxation and comes back as you walk again.
Peripheral artery disease is a form of cardiovascular disease because it affects the blood vessels. It's usually caused by a buildup of fatty deposits in the walls of the leg arteries. The fatty deposits, atherma, are made up of cholesterol and other waste substances. The buildup of fatty deposits on the walls of the arteries makes the arteries narrower and restricts blood flow to the legs. And this gradual process is called atherosclerosis. Plaques are deposits of lipids, fibrous tissue, and calcium that accumulate slowly over time. If the arteries become narrowed or blocked, blood cannot get through to nourish the tissues, causing the muscles of the lower extremities to cramp and lose strength. This process of cramping in the legs when walking is called intermittent claudication. Less often, inflammation of the blood vessels, irregular anatomy of your ligaments or muscles, blood clots in the arteries, injury to the limbs, or exposure to radiation may be the cause of peripheral artery disease. In conclusion, the causes include thromboembolism, inflammatory conditions like Berger's disease, and functional conditions like Raynaud's phenomenon. There are several things that can increase the chances of developing PAD, including smoking, which is the most significant risk factor, type 1 and type 2 diabetes, high blood pressure, high cholesterol levels, growing older, hypertension, a family history of heart disease, and excess levels of C-reaction protein or homocysteine, and finally, obesity.
Symptoms of the PAD disease can include hair loss in your legs and feet, numbness or weaknesses in the legs, changing skin color on your legs such as turning pale or blue, shiny skin, the muscles in your legs shrinking, and much more. Hair loss on your legs and feet, coldness in your lower leg or foot, usually in one leg or foot rather than both, injuries on your foot or toe that don't heal, take a long time to do so, any change in leg color, hair loss as well as slow hair growth on your legs and feet, and slowly growing toenails. If you have PAD disease or are in the early stages of PAD growth, you are likely to have circulation problems. When blood does not fully circulate across the body, it often has difficult time reaching the ends. This is why in winter weather the fingertips and toes are the first to get cold when outside. Poor circulation can affect nail growth in people with PAD disease. The lack of oxygen and nutrients in the nails will cause the nails to grow very slowly or fully stop growing. If you do not pay careful attention to your feet, this sign of PAD may sometimes go unnoticed.
Other than lifestyle changes, there are medications that could help in the process, as recommended by a healthcare professional. Not following direction increases the risk for PAD, as well as heart attack and stroke. These medications could be related to the disease, such as blood pressure medication. They are available by prescription to lower high blood pressure. There are a variety of classes of high blood pressure medications, and they include a number of different drugs, like aspirin, clopidogrel, should be administered in all PAD patients. Various medications can lower blood cholesterol levels. Statins are recommended for most patients and have been directly associated with a reduction in the risk of heart attack and stroke. Statins continue to provide the most effective lipid-lowering treatment in most cases. However, for a minority of patients, the mentioned recommendations and treatments aren't enough, and minimally invasive treatment or surgery may be needed. Angioplasty or stent placement are non-surgical and performed by making a small incision through which a catheter is inserted to reach the blocked artery. A tiny balloon is inflated inside the artery to open the clog. A stent and a tiny wire mesh cylinder may also be implanted at the same time to help hold the artery open. Sometimes a medicine can be given through the catheter, or a special device can be inserted through it to remove a clot that's been blocking the artery. Another procedure is atherectomy. It helps remove plaque from the artery. There's a long portion of artery in the leg that's completely blocked. Surgery may be necessary. An atherectomy is a procedure to remove plaque from an artery. Removing plaque makes the artery wider, so blood can flow more freely to the heart muscles. In atherectomy, the plaque is shaved or vaporized away with tiny rotating blades or a laser on the end of a catheter, which is a thin, tiny, flexible tube.
Now, starting off with the economical factor, in the United States, more than 8 million people have low extremity peripheral artery disease, with a combined annual cost of more than $21 billion. Compared with other US adults, people with a diagnosis of PAD have higher healthcare related expenses and OOP costs. Such expenses contribute to the loss of salaries, caring for family members, and the loss of opportunity costs, raising the pressure on PAD patients. Generally speaking, increased emphasis on recognizing the economic results and cost-effectiveness of treatment strategies for highly prevalent and expensive diseases, such as PAD, is expected by an aging population and growing public focus on the efficient distribution of scarce healthcare resources.
Moving on to the ethical factor. When considering the treatment for the PAD disease, there are some ethical issues that involve examining a specific problem and using values, facts, and logic to decide what the best course of action should be. So they must be taken into consideration to ensure a person's health, whereas the risk of serious complications as well as death in some cases, such risks must be weighed against the opportunity to improve health and quality of a person's life. One problem in particular is that caregivers may have difficulty holding back from the use of new methods even when the documentation is substandard or incomplete. Secondly, a patient's lifestyle, such as continued smoking, must not lead to discriminatory treatment or any different type of treatment. While attempts to avoid amputation, which is the removal of the limb, are a worthy goal, they must be weighed against risks and suffering in patients for whom it may turn out to be necessary after all. Resource utilization, lastly, is an also ethical issue in such cases where it is important for maintaining productivity because it prevents staff from underperforming or being overbundled by workloads.
Peripheral arterial disease, known as PAD, happens when the arteries become clogged with plaque, which prevents the flow of blood. PAD affects the arteries in the legs, while most people think that it affects the arteries in the heart. That may not seem like such a big deal, but even if the arteries in your legs become clogged, you are still at increased risk of heart attack or stroke. PAD mostly affects older people with the age 50 and over, but still, it also can affect other ages. 1 in every 20 people over the age of 50 has PAD. Besides age, other risk factors include smoking, even if you have quit, diabetes, high blood pressure, cholesterol, a history of vascular disease, or a history of heart attack or stroke, all those can be such harmful effects for the disease. Sometimes the disease can present without symptoms, so people may not know they have it. Other times, the disease can cause serious symptoms that impact the quality of life. PED is a narrowing of the peripheral arteries serving the legs, stomach, arms, and head. Peripheral in this case means away from the heart, in the outer region of the body. Both PED and coronary artery disease are caused by atherosclerosis. Atherosclerosis narrows and blocks arteries in critical regions of the body. You can still have a full, active lifestyle with peripheral artery disease, or PAD. The condition happens when plaque builds up in your arteries. This makes it harder for your arms, legs, head, organs to get enough blood. PAD is dangerous and life-threatening because these blockages can restrict circulation to the limbs, organs, and brain. Without adequate blood flow, vital organs, legs, arms, and feet, and your brain suffer damage. Left untreated, the tissue can become infected or die, a condition called gangrene. If you are at a risk for PAD or have been diagnosed with it, it's worth knowing that PAD is easily diagnosed in a simple, painless way. You can take control, follow your doctor's recommendation, and strive to lead a heart-healthy lifestyle. Some cases of PAD can be managed with lifestyle changes and medication.